Hey, good morning, everybody. It's Wednesday, time for a little Wisdom Wednesday. Thought I'd get going early today as it's a busy day and last week got away from me. So wanted to touch base today and talk a little bit about our brains. If you have ever come to see me as a patient, one of the things that I typically tell everyone is we want to do everything about our health that we can to not outlive our brains. Had a couple of grandmothers, both of whom had really wonderfully great long lives, but toward the end, both developed problems with cognitive decline and dementia. And one of the things we'd really like to do is try to produce overall health that will delay or absolutely keep this from occurring for us. So let's talk about what we can do about our brain and how we can enhance brain health. One of the things that we have discovered and know now is that there is a protein made in the brain called BDNF, brain-derived neurotrophic factor. Now, neurotrophic, neuro being brain, and trophic meaning growth. This is a growth factor in our brains, and it not only enhances growth and development, but it can actually repair the brain. And a little bit, I'll talk to you a little bit about some of the things that we can do to enhance growth, but there is actually data to suggest that we can improve the development and repair of healthy brain cells even as we age. So one of the things that I'd like to kind of start with is just understanding that all health really begins in the gut, kind of what we've talked about in the past as attributed to Hippocrates, that all disease begins in the gut. I think health begins in the gut as well. So when we talk about gut health, we know that there are studies to suggest that optimal microbiome or optimal bacteria in our gut actually enhance our ability to make BDNF. And in particular, the type of gut bacteria that is beneficial is the type that is in the bifidobacteria family. For most of us, the probiotics out there have either bifidobacterium or lactobacillus, and it seems that the bifidobacteria are more beneficial for our brain in terms of brain-derived neurotrophic factor, or BDNF. And many of us are very depleted in these types of bacteria because we eat the standard American diet. Now, you can certainly replenish it with probiotics, but enhancing your overall diet, as we continue to talk about, by removing all the inflammatory foods, in particular processed foods and sugars, you're going to enhance your overall brain health. So gut health is important for brain health. The other thing that's really important for brain health is exercise. As I have said many times, exercise is not what we do to lose weight. Exercise is what we do for brain and heart health. And we know that exercise, particularly in the form of high-intensity interval type work, enhances and increases this BDNF. So I would encourage you to get minimum 20 minutes, 2 to 3 times a week with high-intensity interval work, and then just cardiovascular work as well during the week is going to be beneficial for our brain. And let's not forget that that's really what we're trying to achieve with our exercise. So we talked a little bit about gut health and exercise. Now let's look at supplements. What supplements will help the body make more BDNF? Well, we know that fish oil, particularly the DHA component, the docosahexaenoic acid, DHA, that's not DHEA, but DHA, in omega-3 fish oil is very beneficial in helping with BDNF. So getting our fish oil every day. Also, curcumin from turmeric is beneficial as an anti-inflammatory. And most recently, as we've discovered and now that is available to us, the supplement spermidine that we've talked about in all the wonderful things that it can do also has great impact on brain health. In fact, they've done some studies, and even just 6 weeks worth of taking this particular supplement has shown increase in volume of an area in the brain called the hippocampus. So that's very exciting to see the effects of what we can do just to take that. And we know that spermidine's great from the standpoint of sort of what it can do to mimic fasting and enhance autophagy. Speaking of which, fasting also increases BDNF. So we know that as I have talked many times through the several months that we've been doing this series, that fasting has so many wonderful health benefits, but enhancing autophagy and decreasing insulin has great impact on allowing the body and our genetics to take hold and make more BDNF, which is very beneficial from an aging standpoint, and as we age, trying to diminish neurodecline and cognitive decline as well. So we've looked now, obviously, our eating and gut health important, exercise important, supplements important. And lastly, I just wanted to mention the importance of just doing brain exercises. We know that there are so many easy ways to do that today. Of course, crossword puzzles and Sudokus and things like that have always been available to us, but there's apps on the phone. I have one that I really like called Elevate. There's Luminosity, Cognifit. There's a program called Peak, Fit Brain. So all kinds of different options there to enhance your cognitive abilities and just staying sharp and doing new things and exercising your brain. Before I finish today, I just wanted to mention too that on the aesthetic side of our practice, there have been a lot of questions about getting fillers, as there have been reports recently with the vaccine coming out that there have been some side effects and some issues with getting filler and inflammatory responses, such as redness and swelling. And so even though these reports are very minimal, we want to take precautions and encourage you to just know that we would want to do filler, but not 30 days before or 30 days after receiving the vaccine. So just take note of that. And for those of you that are already vaccinated and would like to get filler and it's been 30 days, come on in. For those of you that plan to wait a while or likely will have to wait a while just because of your age, just know that we would want you to avoid getting the vaccine within 30 days of having filler. So you all stay warm. It's cold out there today, and stay well, and we'll talk again next week.